Mastangelo from Volunteers in Medicine, where they provide health care for working Central Oregonians who don't have insurance or don't have the means to pay for health care.
My voice is not too loud. Can you guys hear me in the back? Okay. I had COVID last week, so I'm finishing up with that, and it landed in my throat. But anyway, so I'm going to start with a little joke. You all know why nurses always carry red pens? It's just in case they need to draw blood. It's a good dad joke, right? So I always like to start off with Volunteers in Medicine, who we are. And we are a free clinic and also a free charitable pharmacy, the only one that is licensed outside of Portland in the whole state of Oregon. We're staffed by, we have a small professional staff, but then we're also mostly staffed, all of our healthcare is provided by volunteers. We don't charge anything to our patients for the care that they receive because it is provided by volunteers. And we've been around now for over 20 years in Central Oregon. We serve Deschutes, Crook, and Jefferson counties, so anybody who lives or works in those counties, if they meet our eligibility criteria, they could be a patient at them. So what do we do at the clinic? We provide primary and specialty care with retired physicians, and then we can also provide more advanced specialty care. So if somebody needs surgery or an x-ray or a CT scan, something like that, we have a whole network of pro bono providers in our community that will take our patients if we refer them at no cost to the patient. And they will just do that as a pro bono piece of being a physician in our community. Over 1/3 of our patients are diabetic. And that's compared to about 10% of the general population. So the number of patients we have with diabetes is about 3 times what the rest of what Central Oregon is. And we also provide dental and vision care, including cleanings. We have some contracted dental hygienists who come in. We have a dental room that we can take care of all of that. And then really, really importantly, through our charitable pharmacy, we provide free medications for our patients. So you can imagine, I'm on a couple of medications, I'm sure a lot of you are as well. If you had to pay retail cost for those medications because you didn't have insurance or you didn't have Medicare, you know that that would be prohibitively expensive. And so through our partnerships with groups like Direct Relief and AmeriCares, and some of the pharmaceutical companies like Merck or Pfizer, we are able to get those medications donated. We have a pharmacist on staff, and then we are able to give those to the patients at no cost. So who do we serve? So to be eligible at Volunteers in Medicine, you have to be low income, and you have to be working, and you have to live or work in Central Oregon. So most of our patients are in working families. Most of our patients, the jobs they have are their minimum wage jobs, or they are gig work, or they're seasonal work, and so trying to add up to enough hours every week just is a really difficult thing for our patients. Typical jobs they would have would be things like housekeeping, construction or roofing, landscaping, agricultural work, ranching, and food service. So those are the typical ones. Obviously we have ones that do other things too, but that would be a really typical patient for us, somebody who's doing frontline manual work. At VIM, even though we're a free clinic, we are really, really proud of the quality of care that we can provide to our patients. And we also are part of the community in some broader ways too. So for example, I don't know if you all remember during COVID, we had the Mass Vax clinic that was at the fairgrounds. So Volunteers in Medicine, we actually loaned our volunteer coordinator to Deschutes County. And they became a Deschutes County employee for most of a year and helped organize all of the medical volunteers there. So they used our volunteers, we have that whole database, the county had a database. In order to use volunteers at that clinic, you have to go through licensure and background checks and all sorts of things, because you can't just let people say they can give shots when they don't know how to do that. And because we do that all the time, our volunteer was really well trained and knew exactly how to do all of that. As a result, the mass fax clinic that we had here at the fairgrounds, excuse me, was one of the largest in the state. And because we got it up and running so quickly and so well, we ended up in Central Oregon with higher vaccination rates compared to the rest of the state. And most of our patients are Latino now. The Latino vaccination rate exceeded every other region in the state. So we were really pleased with that. One of the results of that for our clinic was that, excuse me, during COVID, over 1,000 patients we had, and only 5 of them needed to be hospitalized at all. 1,000 patients doing frontline work, couldn't stay home, living in multi-generational families situations. Only 5 needed hospitalizations. Not one patient went to the ICU, and not one patient died. And so we are really proud of those results. We also, like I said, I mentioned before, 30% of our patients have diabetes. Our patients have better diabetes control than other clinics throughout Central Oregon. So for our clinic, about 85% of our diabetic patients are in good control, and that compares to 75 to 80% for the rest of the community. So as a community, we're doing well, and we're doing better than the rest of the country. But at Volunteers in Medicine, we're doing even better than that. So we're really proud of that. So that's about them. I'm going to switch gears now because healthcare is in the news right now. And one thing that people are going to be learning about really soon, excuse me, if they're not paying attention to it already, is that anybody who has their insurance through one of the ACA marketplace plans, or a lot of small businesses do as well, the premium subsidies are scheduled to expire on December 31st. So part of what made the ACA insurance, thank you. Part of what has made that affordable for people are these subsidies. So you pay for the insurance up front, but you have subsidies, and you get tax breaks on it. So that's going to be going away December 31st. So I'm going to give you an example of what that might look like for someone. So for an example, there's a 55-year-old couple, and they both work, and their annual income is about $85,000. So right now, if they were going to be on a silver plan, their total premium for the year would be just over $20,000, right? But they get tax credits of just over $13,000 a year, which leaves a total amount they have to pay for their insurance for the year of just around $7,000, which comes out to about $602 a month. So every month, $602, that's just what they work into their budget, and they can make that work. Next year, without those subsidies, that number is going to $1,732 per month. So from $600 to over $1,700 in a month. And then if the projected rate increases go through as well, they're projecting average across the country is going to be about 18% increase in premiums. That number now jumps up to over $2,000 a month for a family, for a couple making $85,000 a year. So that's over 200%. Now, you can imagine if that's your situation and rent is not going down, groceries are not going down, gas prices seem to be staying pretty stable, but you can imagine that that is not an amount of money that a couple could pay. So a lot of people are going to be dropping their coverage, and they're just going to be doing a lot more praying, I imagine, to make sure that they just are not going to need that kind of care. A lot of people who work for small businesses, people who are self-employed, those are going to be the typical people that we're going to see impacted by this. Other changes that are going to happen, so let's leave aside the marketplace. Let's just look at Medicaid. So overall, throughout the country, there are going to be some changes, some increased requirements. So in the state of Oregon right now, philosophically, the state is, they really feel that everybody should have access to health care. And so how they've done that is through the Medicaid program. And right now, once you're eligible for Medicaid, if you're a child, that eligibility stays with you for 3 to 5 years. You don't have to come back every year and reapply and end up, oh, I forgot that and I missed the deadline and now I didn't have coverage and now I need it, so I'm going to go back on. You don't have that on and off happening in Oregon. That's going to change. Nationally, they're going to start requiring that those redeterminations happen every 6 to 12 months. So there's going to be a lot more paperwork and a lot more administrative expense. And then there are going to be probably work requirements that they're going to be looking for states to adopt. Won't happen in Oregon next year. Could be something that we're looking at in states that have tried this. And I'm thinking of examples like Georgia and Arkansas. Going into this in good faith, hey, we really want people to be motivated to work. Medicaid is not for people who are able-bodied. It should be for people who really just can't go anywhere else. They have had a lot of trouble trying to have a system that can track that can do it on a regular basis, and that's accurate. And what they found is a lot of people who are actually eligible have so much trouble in that process and getting the paperwork through that they end up being denied even though they should be eligible. So that's going to end up with a lot more people coming off and being uninsured. Another thing that's happening in Oregon is the state, and they're going through some more budget stuff right now, but how they were trying to balance the budget with Medicaid was to hold down how much they were going to reimburse for care. And what they're finding is some of the CCOs, groups like Pacific Source, are saying that in some markets they are literally losing money and they cannot sustain those losses, and they're going to be pulling out of markets. And so that's not happening here in Central Oregon. They're going to renew the contract here. But in places like Lane County, that's going to be a situation. Yeah.
Well, a couple of things about that. I work closely with Pacific Source and other Medicare and Medicaid carriers. They're not going out of here, but Providence, which is the only other carrier here for Med Advantage plan, the Medicare D-SNP plan, dual eligible plans. They are closed. So they're basically going to be left with one carrier.
Yeah.
And that's largely because of the federal mandates for benefits. And that's going to also result in the carriers that are left seeing the premiums go up substantially, seeing co-pays and deductibles go up, because they are in fact losing money. Even when they double the premium, and that's about the most they will be allowed to do by CMS, they're going to be still losing money.
Yeah.
So you're going to probably see sooner versus later more of those carriers just leaving the market entirely.
Yeah.
So we'll see.
Yeah. Healthcare is going to continue to be in the news over the next couple of years as a lot of this shakes out. It's not going to be getting better. And it is not like these increased premiums are making St. Charles really rich. They are also losing money. And then the downstream impact of that is that they lose money, they have to cut services. Access for everybody starts to decrease because we can't pay doctors enough to afford to live in Central Oregon. They go somewhere else with and have a better standard of living, or they have a lot of loans to pay off. And so they just cannot afford, even if they wanted to live here, they couldn't afford it. Yeah.
Well, the other thing, you talked about Medicaid eligibility standards. A lot of those were loosened up significantly during COVID. And this is kind of an overhang from COVID. And now you're going back to what the original eligibility standards were pretty close. If you didn't expand your Medicaid program at the state level. And, people don't qualify anymore.
Yeah.
And that's a sad fact. And kind of know what to do about that. Put more money into it, you do that. But there's not a lot of extra money around to do right now.
Right,
So
yeah.
the states can make independent decisions, certainly, about that, but, that's unfortunately the case.
Yeah, and you're absolutely right. And after COVID, during COVID, they just kept, letting people extend their eligibility. After COVID, they started going back to a more frequent return, but the feds are looking at making that even more frequent. Excuse me, one thing that is happening too that we're seeing, with inflation, one other impact of inflation is that wages go up, right? That's part of what causes inflation. And that means that people start to make a little bit more, but instead of being able to get ahead, it means that they make too much to actually be eligible for Medicaid anymore. And so now they're in a situation, they're not wealthy, they don't have a lot of money, and they can't afford insurance, and now they make too much for Medicaid, so what are they gonna do? Well, hopefully they're gonna know about volunteers in medicine, and they're going to come to our clinic and see if they can be eligible, because that's exactly the group that we are looking to take care of. They make just too much for Medicaid, and they don't make enough to afford insurance, and they don't get subsidies through the ACA plans. So in the past, that has been recent immigrants. If you had been a recent immigrant to this country, you had been here less than 5 years, you could get an ACA policy, but you would get no subsidies for that. And so you would have to pay that $20,000 figure I told you, that's what you would be paying in full. Well, if you're making, $40,000 a year for a family of 4, that's half your income, that's just not gonna work. So that's exactly the group that we're here to serve. Too much for Medicaid, not enough to buy insurance, and you likely have some issues that you're trying to take care of. So most of our patients, we don't have a lot of just like healthy people with nothing going on. If somebody's finding us, it's through word of mouth, and it's because they've gotten a diagnosis, or they need a surgery, or they need glasses, something like that. They're going to try to find us, because going through our eligibility process, it's pretty stringent. Because of our partnerships with the charitable pharmacy groups, we have to have very strict eligibility guidelines. You cannot be eligible for Medicaid or Medicare. That's part of our agreements with these pharmaceutical companies, because if you have that coverage, your medications are going to be covered, so they want you to have coverage. So we have to actually go through a process to confirm you're not eligible. And then we have to have pay stubs, we have to have affidavits, we have to have, sometimes if they're self-employed, we have them actually do a budget for us to show that and we see bank statements to make sure that, that we have confidence that they really are that population that we are seeking to serve. Excuse me, but after you go through that, you're eligible for a full year. We don't make you come back for a year to do eligibility again. And during that time, you're going to probably end up, most of our patients, I think the average patient now is what, over $700-800 worth of medications a year, if not more. And patients need things like surgery. Patients come in because they're worried that they have cancer, and they do. Right now we have a couple of patients that have come to us. They actually found out they had cancer in the emergency room, and the emergency room called us, can we get them in? Can we get them set up for care? And those are really heartbreaking cases, because a lot of the time they knew something was going on, and they were so afraid to find out what it was, because they didn't want to bankrupt their family, and they were afraid what this would be. So when they come to them, we're able to get that all coordinated for them and take care of them. Yeah.
More questions, this will be my last.
That's okay.
What about no-print funding? I haven't looked at this in a while, but hospitals have an obligation to provide some level of charity giving as well. I don't know if St. Charles is meeting that obligation or not. I would assume they are, but they're the only hospital in the area.
You are the greatest person to have in the audience today. Yes, so we partner really closely with St. Charles. And yes, you are absolutely right. Any nonprofit hospital is required, because they don't have to pay property taxes, right? So in lieu of that, they do have to provide charity care. And our patients, when they go to St. Charles, they need a surgery, that care is written off as charity care. The nice thing for St. Charles is that instead of somebody coming in and they haven't been under care, they can't get the medications, they don't have to do all of that coordination. They can still be our patient, and St. Charles should just do the part that they do best, which is that surgery part. And so partnering with them, it keeps people out of the emergency room. Our patients are half as likely to go to the emergency room than the general population. And that's in part because they're afraid of the expense, but in part it's because we have really great access. We have people that speak their language and can make phone calls and to talk them through things. And a lot of times, if you can just talk to somebody, you've got away with it. So, might get close to time.
Yeah, probably,
Okay.
but,
Real quick, do you do dental?
We do. We have limited dental, but we do. And it is the biggest unmet need in Central Oregon. And even people who are on OHP have a way to pay for it. They have trouble getting in. So we are thrilled that we got a chair donated from ADEC, which is over a big company over in the valley. And we have a beautiful dental room now, and we have a couple of hygienists who actually speak Spanish who come in. It's amazing. So what can you do real quick? First of all, keep yourself educated. Listen for this in the news. And then if you know somebody if it comes up in conversation and they're worried about what their premiums are going to be and they get sticker shock, tell them to go to our website. They could just Google VIM Cascades or VIM and Bend. They're going to find us, and there's a whole process for them to do. They can do an inquiry. We would love to talk to them and see if we could be a home for them. So, final joke. Two millennials are going out for coffee, and one says to the other, oh, by 2026, health insurance premiums went up 40%, but my costs are going to be 30% lower this year. And their friend, the second millennial, says, wait, I'm confused. How is that possible? And they say, well, that's easy. I won't have any money left for food or rent, so I'll probably die halfway through the year.
It's a little stingy.
Hey, I'm the millennial in the room.
Yeah, that's right.
Maybe a couple
That's
more.
right.
I thought it was flavorful. I mean, people ask us why we're not having kids, and it's because we can't afford it.
well, that's some
We
truth.
can't afford kids.
All right, let's give Kat a hand here.
Thank you.
Kat, we got a gift for you here.
Oh, beautiful.
Crafted pen.
Oh, this is beautiful.
Yeah, no, please, you don't use your computer. Appreciate it.
All right. Put all these on everybody's table, even if you can't attend, take this with you, show them to somebody who might be able to.
Yeah, our big fundraiser, Heart of Healthcare, is coming up actually October 9th, so it's the day after you all have a big event. But we
Is
would
there
love,
information on that on the card?
yeah, those are invitations, so just feel free to pass them around, share them with folks you know.
You guys joke.